And we will begin recording our session this evening for parish nursing and faith community nursing. I'd like to open today by welcoming everyone, and I'd like to open with a prayer, if we could, please. Gracious and loving God, we thank you for calling us to serve in parish nursing, a ministry of healing and care. Send your Holy Spirit to fill us today with your wisdom, compassion, and strength. May our hands bring comfort, our ears listen with understanding, and our hearts reflect your boundless love. We lift in thanks the faithful service of Pat Colburn and Dr. Pruski, who lead and guide us today as partners in science and faith. Help us to see Christ in every person we serve, especially the lonely, fearful, and suffering. Remind us that our work is a holy calling, bringing your presence and peace in our communities. In Christ's name we pray. Amen. I'd like to welcome everyone to meet Pat Colburn. Pat is a retired registered nurse with a bachelor's of science in nursing from the University of Tennessee and a master's of nursing from Louisiana State University. She has a clinical specialty in adult mental health and has practice areas in clinical nursing service for inpatient mental health units, nursing administration, nursing education, and parish nursing. She's also a health minister with a health minister certificate from Wesley Theological Seminary and is a certified lay servant with the United Methodist Church with the Peninsula Delaware Conference of the United Methodist Church. I'm honored to have received a call from Pat several months ago to connect our efforts with Newcastle Presbytery. And I'd also like to greet Dr. Tom Pruski, who is the Associate Director of Community Engagement of the Community Engagement Institute at Wesley Theological Seminary in Washington, D.C. There, he directs the work of the Heal the Sick program, and he's the Associate Director of the Community Engagement Institute there in Washington. Tom serves as a lead faculty and curriculum manager for its Health Minister Certificate, which is offered to a national audience, and he has trained over 500 people within this curriculum. He serves as a faculty member for several Faith Community Nurse Foundation courses. Tom's trained advocates to lead a variety of health ministries and health and wellness initiatives in their congregations. Tom is actively engaged in regional and national collaborative conversations on faith and health partnerships throughout the United States. Welcome, Dr. Pruski, and we appreciate your time today. I'd like to now turn this portion of the program over to Pat Colburn so that she can discuss what is parish faith community nursing.
Okay, Donna, thank you so much. And I'm really excited to be here because health ministry is one of my passions. I was a parish nurse, now called a faith community nurse, for about 9.5 years, first at a Methodist church and then at a Presbyterian church. And I'd like to give you the highlights of my experiences and what we're seeing with other faith community nurses as well. But faith community nursing is a specialty area of nursing practice that combines health and faith. A faith community nurse is a registered nurse. They have additional training and they provide holistic nursing services within a faith community. These nurses deal with the psychological, the physical, emotional, social, and spiritual aspects of well-being. But the core thing to their practice is spirituality. That's key. This is a no hands-on nursing practice. In other words, they don't give medication. They don't do any invasive procedures. One of the things they do is work with individuals to help them to take control of their life and take steps to improve and promote their health and sense of well-being. But the main focus of faith community nursing is the intentional care of the spirit. Now, parish nursing came about in the middle 1980s. Granger Westberg was a Lutheran minister, and he was also a hospital chaplain. But he really believed that the well-being of a congregation could be enhanced by the expertise of a nurse. And in 1984, in partnership with one of the hospitals in the Chicago area, he set up a parish nurse project, and 6 nurses were placed into 6 different congregations. And apparently that worked really well because parish nurse programs were implemented throughout the country and also in other countries. Now, in 1996, I had the opportunity to attend a parish nurse workshop where I lived in Florida, and it was led by the director of the National Parish Nurse Resource Center. And the first thing that they presented, the first topic was the church as a place of health and healing. And why not? When we look at scriptures, there are many incidents of healing by Jesus. He healed people physically, mentally, and spiritually. His ministry was holistic. He cares about the whole person. And not only that, in Matthew 10:8, he said, heal the sick. And the church was the original healthcare institution for hundreds and hundreds of years. But as we look at current health challenges today, people live longer, we have more people with multiple health conditions, with cost containment. People don't stay in hospitals as long as they used to. It's frustrating to access health care. So there's a lot of fragmentation. But this thing is something that can be addressed by a nurse in a church. And what better place, especially in today's times, because what we're looking at, the church is a trusted source. People with health problems will go to their faith leader or people within the congregation first when they need help. The church is service oriented. There's a lot of opportunities in the church to impart information. There's a lot of media resources that's just phenomenal. The population that we have in the churches includes individuals across the lifespan. It includes families. It includes groups. And the other thing that we can look at in the church are people come from all walks of life, all different types of socioeconomic backgrounds, cultures, and races. So there's an opportunity to meet with a lot of people in the church. Ministers, one of the major things that they do in their work is deal with health-related issues. And a parish nurse can be really helpful in that situation. They're able to identify people with special needs that use the help of the minister. They also provide spiritual care. They assist with visitation. And another thing that's an extra, but when you have a parish nurse or a faith community nurse, you're dealing with health issues. And the minister himself or herself, as well as the staff, can benefit from that. Generally, parish nurses or health community nurses are free with their services. What their activities do are geared specific to the needs of their congregations. They can provide spiritual care and deal with the whole dimension. Now, when I went to this parish nurse workshop, there were parish nurses from all over the country. And it was amazing all the things that they did. Their activities overlapped, but there was a lot of differences. And so it ended up they were like snowflakes. There was no 2 parish nurses programs alike. But what I wanted to do, there's no way that I can tell you all the things that they did and all the things that I did, but I would like to highlight some of the roles of nursing and some of the activities that go with those roles. First off, faith community nurse, and that has replaced the parish nursing name, but the faith community nurse is a health educator. They provide health information to improve, promote and maintain health. The church is the perfect place for that. I told you they have a lot of resources. You can impart health information in the church bulletin, in the church newsletter, in health ministry moments. There's bulletin boards. Um, People can do health fairs. There's a lot of small groups already in place that you can teach to. When we started, I had a partner at the time, we started doing blood pressure screenings. We taught classes to the church circle. We taught health maintenance classes to the young adults. We arranged for CPR classes for the ministers and the ushers. 1 month in February, so I highlighted um, women's health care in Women's Heart Month. And so what I did, I had a health ministry moment in the church service. I provided extra blood pressure screenings. I went to the American Heart Association and came back with so many resources. So I set up a table in the narthex with a display. I published healthy heart recipes into the church newsletter. We also had set up a health and wellness uh, section in the church library. One of my favorite things is one of the parish nurses in our area. She used to put a notice to remind women of different health screenings that they needed to have every year. And she would put it in the ladies' bathroom inside the stall so nobody would ever miss that. Faith community nurses also work as health counselors, and they provide counselors on a personal basis to people that are having health concerns and health issues. And one of the most common things that we dealt with people trying to clarify health information. You know, you go to the doctor and you're kind of afraid, and health care providers have a totally different language. So then a few days after they'd been to the doctor, they'd come in. I was at my doctor's and I thought I understood everything, but I'm not sure what these words meant. I'm not sure what I'm supposed to do next. We would also help people come up with questions when they were going for their annual visits that so they could ask their doctor. We provided medication education. We helped people as they adjusted to different lifestyle changes. Maybe they had to monitor their blood pressure at home, so we would help them get that set up and teach them how to do that. We also did visitation in the home, nursing home, and the hospital, and could work with people as they were getting ready to be discharged. Another thing that we did as parish nurses or faith community nurses, we were liaisons between the faith community and external resources and services. One of the main things we did in Florida was refer patients to different resources. For example, someone might be newly diagnosed as a diabetic, and then we could refer them to the support group that was at the hospital. And that was important because we had a lot of winter visitors, and people would come down for maybe 4 or 5 months at a time. Some people would come down and maybe only for a month, and they plan on having any problems with their health, but things do happen, and we were able to connect them with available resources there. We also brought community resources into the church. We had the Visiting Nurses Association do a flu shot clinic for us. The public health department in our area had an immunization van. They would travel around the county and settle at different sites so that they could service the community. And we asked them to come to our church parking lot. And one of the advantages of that was we were not only taking care of people within our church, but also reaching out to the community. Then I belonged to 2 parish nurse organizations when I was in Florida, and it was a great way to get spiritual support from your peers, but we also shared information and resources and services. There was one parish nurse that would come out to different churches to do CPR classes. And then one fall, back in 2004, we had threats of 4 hurricanes in our area. And I lived at the top end of the presbytery. People in the lower end were in Fort Myers. I was in Bradenton. Nobody knew how to evacuate because this hurricane just like settled out in the Gulf and we were all waiting. When it got close, and we knew where it was coming. So people in the presbytery went and got some of the elderly residents who had special needs and brought them up to Bradenton, where we had a Presbyterian housing. That worked well, but they were not able to go back home because of all the damage that had happened after the hurricane. So the parish nurse down in Punta Gorda had contacted us to see if we would do visitation with these people, help them connect with resources, help them keep connected with their own church. And they were just devastated and just really needed care of the spirit. Another thing that parish nurses do, or faith community nurses, is they're health advocates. They help people access the care and the services they need. One of the things that we often did was work with people in making healthcare decisions, making sure they had the resources that they needed to make the best decisions they could and support them in that. We help people access the healthcare system. Sometimes that meant even going with them if they had no other family, no one to help them, and we were able to help them work with understanding what was going on. Even going with people when they needed to go have surgery, so I could be there to help them. We work with the underinsured and uninsured. We had people that were not able to get their medication and get services for other things as well. And one of the nurses in Sarasota had a special fund that she had for prescriptions for people who were not able to pay for their medication. We also worked with the church in making sure it had the things it needed, like an AED. That it had, we were able to audit to be able to increase the inclusion for people with disabilities. We updated first aid kits. We updated protocols in the church. The other thing that parish nurses and faith community nurses do is facilitate support groups. And one of my favorites is a story about a faith community nurse who overheard people in her church that were elderly complaining about the effects of the aging process. So she started a support group for them. Faith community nurses also coordinate volunteers and in visiting people in the hospital, and you know they're going to be discharged, assessing their needs. You can get people within the church to help with things that they might have, such as needing a meal train or needing transportation to the doctor. And probably one of the most important aspects of being a community health nurse is integration of health and faith. I've been a nurse for a very, very long time, and one of the things that I know that exists is this person's sense of spirituality. That is the most important part. It has the greatest impact on a person's sense of well-being, good or bad. And so it's really important to provide spiritual care to individuals. And everybody needs that, in my experience. And that involves listening, praying, integrating rituals and sacraments into their health. The most moving thing that I've ever seen is in giving communion to somebody that's homebound or in a nursing home, and you can see what it means to them in their eyes. And I get really misty about this because I've seen this over and over. But that gives them comfort and a sense of security. These are rituals that are important to us, and so sometimes they get forgotten. I've been in nursing for a long time, as I said. I was a parish nurse for 9.5 years. And one of the first things I started doing was doing blood pressure screenings every Sunday. And we had maybe over 500 people a year come in to get their blood pressure screened. The reality was they most people did not have a problem with their blood pressure. And it became apparent to me one day when a lady came in. She had waited in line, and we had a privacy screen. And she came and sat down, and I picked up my stethoscope, and she said, no, I don't need my blood pressure taken. My blood pressure is fine, but I'm on a medication, and I can no longer afford it. I'm on Social Security. I don't make enough money, and I can't afford my medicine. And she was just completely devastated. two other ladies came in and they had a growth on their faces. They came in together and they were laughing and all. And they said, Pat, do we have cancer? And I said, I have no way of knowing that. You would need the assistance of a dermatologist. You would need to have a biopsy. And they got serious about it. And I said, what would it be if you went? And they said, well, we're just afraid that people think we're overreacting, but we knew you wouldn't. And we talked at length, and they ended up deciding they were going to go to the dermatologist. But they were scared. They were sharing their fears. They came back a couple of weeks later, both of them. One had cancer, one did not. They were glad that they had gone, but they were very frightened by what had happened and did not have a place to go to talk to somebody that would talk with them seriously about it. The thing is, we all want to be healthy, but when we receive a threat to our health, whether it's real or not, it's very, very scary. And I kept seeing people coming more and more, not for their blood pressure screening, but to share their concerns. And some of the concerns were serious and some were not. It didn't matter. They were all significant. People want to be taken seriously. And so I would often just sit with people. I would listen. I mean, I would really, really listen. I would take their concerns seriously. I would provide spiritual counseling. We would pray. We would read the scriptures. People would love to look for a scripture that they could take with them that would help them, that they could read every morning. And sometimes I would just sit with them. They would cry. I would hold their hand. But sometimes I would just sit with them. And the major role I played when I was a parish nurse was that of providing spiritual care. The major thing that I did was to be present with them. And I read an article not too long, it was old, it was about hospital chaplaincy. And they talked about the ministry of presence. And the heart of faith community nursing is not the skills and the procedures we learned in nursing school, but it was the human connection. That is the most important thing that we had to offer. And it was being present and caring for the spirit. So that's what it's truly all about. And every parish nurse, every faith community nurse that I know were called into this type of ministry. So,
Thank you
so
so much, Pat, for giving us an overview, purpose, some goals, some services and benefits for the congregation, the spiritual support aspect. We greatly appreciate your overview. Dr. Prusky, would you like to talk to us now?
Sure. I'm going to cover both education and training, how we prepare faith community nurses, and then I'm also going to talk about the lessons learned of current faith community nursing opportunities. What I'd like to do first, though, so that I'm not talking at you but with you, is just get a sense of if people could put in the chat what their role is. Are you clergy? Are you a faith community nurse? Are you a pastor? Because knowing what your interest is in the conversation would help me greatly to know. So if you could just type that in the chat or just come off mute quickly and say that, that would be wonderful. It will really help me to, I guess, to really contextualize my comments and also what's there. Okay, great. Wonderful. Thank you. Pastor, elder. So administrators, all up and down in terms of, so just as a quick connection, as Pat was describing, Pat, as mentioned, was as a faith community nurse practicing and then came to Wesley in our program. We have a health minister certificate, which helps those who aren't nurses to around health and wellness in their congregation and these same concepts. So there wasn't a training around. And so I was on the board of the Health Ministries Association at the time. And so my role was to develop not one, but two sets of different guidelines, versions that would help those who are not nurses or those who are retired nurses to be involved in this. And that's where the health minister certificate came from. And I'm going to talk a little bit more about these organizations that help, um, some of these different pieces. And so with education and training, there's a thing called, you have to first, as Pat was describing, um, a active licensed registered nurse for the faith community nurse role. And one of the things that's important there is um, those that do the training, mainly the Westberg Institute for Faith Community Nursing, does a lot of the course is called Foundations of Faith Community Nursing, and it's about 36.5 to 50 contact hours, and it focuses a lot of what the roles that Pat talked about, namely spirituality, holistic health, community health. So it's a really specialized training. There are other curriculums that have been out there that follow these guidelines. There was a book here. They just came out with a new scope and standards. I hope you can all, well, let me get my, hold on, my, take the blur off my thing. But this is the latest fourth edition of the scope and standards of practice. And I think I can connect with Donna and Pat to make sure you have that. But I was a contributor to this in terms of the practice of 25 years of different experience. And Pat did a wonderful job with the history and the pieces there. And also, the latest that's going on with AI or the challenges in faith community life that we all face. This is, like I said, it's the fourth edition. And so those are the guidelines for that foundation's course, which is very important. The National Professional Membership Organization for Faith Community Nurses is the Health Ministries Association. And so working together, their logo is on the corner along with American Nurses Association, publish this document every couple of years. It's around every 4 or 5 years. And it's the latest guidelines. Now, the Westberg Institute I was describing, there are organizations that partner with that institute, which is it's under the Ministry of Spiritual Care Association, namely chaplains that work with. There used to be another organization that led them in their work, but they have a whole educator section for faith community nursing. And so one of the particular things that they work on there is setting the education and the foundation, and the curriculum has evolved over years. And so this is a specialty practice. There used to be a specialty designation with the American Nurses Credentialing Center to demonstrate expertise. Since the population of practicing faith community nurses is not that large, the credentialing is no longer available. But some do have that credential already, and it's renewable. And it was done by portfolio, so demonstrating your expertise, like Pat was describing, in our own practice. People could submit those different portfolio practices if they did a health fair or a health event. All of those different roles that a faith community nurse would undertake. And so is also an experienced nurse. It's not a novice nurse or a new grad, usually someone who's had 2 or 5 years of experience, who is in this role of health assessment, problem solving. And then to reiterate what Pat was talking about, it's intentional care of the spirit, both for the individual and the community. What I define community as the congregation and also the community surrounding the church, the local neighborhood, is most often the practice there. And so, the big part with education and training, most of those have gone online because we're in a hybrid model. Because of the accessibility of the busyness of everyone's life, the nurses themselves. And so, as Donna was mentioning, I teach in a couple different ones. I'm in Washington, D.C., but I teach in different ones out west and also in the Midwest in terms of hospital ones, based programs. And so, I think again, and they pull from people from all over the United States, just like our health minister certificate program at Wesley does. And so this is the preparation that people take in order to prepare themselves for faith community nursing. Um, and it's really involved in practice. And I think the other highlight as we move into the lessons learned or current opportunities, I think the biggest part is that I'm seeing faith community nurses work with health ministers or other folks who have other skills and gifts. Um, there's a particular network out in the West in Oregon, in particular, which is working to document some of the health impact that they're having. So they're working with health workers, community health workers who have become health ministers, or those from the churches, to show the impact they do have on health, working alongside faith community nurses. Faith community nurses, of course, as Pat was talking about, have that specialty trait to do blood pressure screening, some of these other things that nurses do. But it's also a ministry of presence across the board, I think, in terms of, and also giving trusted health information, which has become quite a challenge in a lot of areas. And looking at those particular pieces so that people can have that information from a trusted resource, and help people, especially congregations, come together around particular health needs. It's not just the needs, but also getting the gifts that people have and activating them. Actually, living your faith is part of a big part of these ministries, both for health ministry and faith community nursing. I mean, we're particularly talking about faith community nurses. So this is a particular call for nurses, themselves to engage in this. And so that's really important. One of the particular things as I was getting ready for this call was there's actually a Presbyterian Health Network, but the last date that I saw for that was 2016, believe it or not. And so I'm going to put this in the. It's an old resource, but it's an interesting part, because I think it's important to know what the history that was going on with in particular this ministry. And as people and COVID hit, this was probably right before around that time, a couple of years, there was a lot of changes that happened. Either faith community nurses retired or different changes went on. And so this is a unique opportunity to really activate our congregations, and agency wise to really focus on health and wellness within that mission. I saw also doing a little research, Matthew 25 is a big focus for the Presbyterians, in terms of looking at that. How do we serve our neighbor with food, clothing, and shelter? Well, this is a wonderful part around health and holistic health to be able to activate that. Um, I think one of the challenges with this is that, with faith community nursing, it's to work together with other ministries and also activating other gifts and talents from other professionals or volunteers, so that it's not just the focus on the nurse themselves, but the entire congregation and really getting them involved. And so that takes a lot of skill. And so one of the things I do at Wesley Theological Seminary, I started out as a faith community nurse myself. I went to Chicago for my training because there was no other trainings at the early onset of this. And so where Granger Westberg started, they had the Westberg Institute was there at the time. And then I also took coordinator training. But as I went on, I also saw that there wasn't opportunities for those who weren't nurses. And so working on the health ministry part, to have this accessible and also for people to share their different gifts, because we're all in charge with the mission of preaching, teaching, and healing, within our faith and our denominational mission. And so that's what came about in terms of my work at Wesley, and also developing a health minister certificate to train now over 500 people in 42 states and also 5 or 6 different countries, to really work on these things. And so we teach them basic skills just briefly around, you know, health assessment, communication, organizing, active listening, spiritual care, self-care, mental health. Also, just basics of defining what health is for themselves. We throw this around a lot in terms of defining it themselves. We ask people, what is a healthy person and what is a healthy community to start the training itself. Ask the questions which, we take for granted and define that. And so by engaging in conversation with the students, we all come, to this conversation and really look at what that means and constantly looking at that within our congregations. The other piece to this is that we also go over accountability, advanced care issues, which is a big part, end of life, accountability and professional responsibility for nurses themselves. That's often a common question that we face. And so, there has not been any faith community nurse that I know of that's been sued or anything else that had, and so that's an important part because pastors in the time that I also get a question as they pursue this is what's the legal, issues with this? Focusing on the spiritual care issues and the intentional care spirit issues, there has been no legal or any other incidents with faith community nursing at all, even health ministers, as long as they focus within that practice. And that's why the training is so important. Another part is that after the training, the foundations course for faith community nurses, it's also to be connected to a network, whether it's with a denomination, whether it's a local healthcare institution, a hospital, community organizations, because that's where the practice really takes hold. Those relationships of connecting with people is critically important. That's where they get continuing education, connected to other people, and also focusing on the local area of their neighborhood, their congregation, and connecting. And as Pat was describing, this is across denominations also now. I see here in the chat that Pat put there was over 600 Presbyterian nurses in 1998. We are in different times, of course, and different challenges. And so to revitalize this is very, very important. And it's going to look different, whether it's faith community nurses or health ministry, health minister training. We're all responsible, especially I think, you're seeing this now, of how active we are in living out our faith or in our community, being involved in civics, public forums. This is a really important part. Advocacy issues. It's extremely important to be engaged. And so having that healthy balance is also important. And so the foundations course also teaches strong team, integrating care, clear boundaries and role definition. Burnout is a very important part within our society. And so having clear roles, Pat went over that, of course, cultural sensitivity training, being aware of your own views, especially, whether it's mental health or different cultures or different religions. We go over a lot of those different trainings. Another part that we have evolved with at Wesley is when COVID happened, we created an online network for our health ministers. And so I average around 20 people or so in monthly meetings, and that's gone on for 6 years now. And we have, I do continual surveys or assessments, just like I'm talking about with that group. And one of the particular trainings that people have asked for was adult mental health first aid training. So I became an instructor, and then 3 or 4 years later, and 200 people trained after that, not just our health ministers, but allied ministries in different geographic areas in the United States. That training is very important because it complements, the health minister training or the faith community nurse training to help them with their practice. And so these are real skills that help evolving needs or constant assessment. And so those are the really important highlights I think look at. I know I have a couple more minutes, but I wanted to see if there's any questions in particular, highlights that people have. I know we're going to do that later on, but just take a moment if there's any points of clarity that people needed.
That's perfectly fine. Please,
Okay.
I
Okay.
welcome you to please unmute yourselves and ask some questions if you desire.
Yeah, so Mark, I see in the chat here, can physician assistants, so there's an advanced practice part. No, that's different. I would probably be more of a health minister role. Advanced, there are some guidelines for advanced practice nurses, like nurse practitioners and such, which are in the guidelines of scope and standards. So that's different, Mark, a different practice. Since they're not nurses, that falls under a different scope and standards for them. So they wouldn't be able to. They wouldn't be able to fulfill the role of a parish nurse. Anyone else?
Christy, would you say that in today's day, the term parish nurse is really not used? Is it more of faith
Yeah, I
community
would agree. The
nursing?
reason, yeah, Donna, that's an excellent point. I would, as Pat was referring to this too, faith community nursing is the latest, and especially in older versions of the scope and standards, they use parish nurse, but it's more encompassing, of different denominations and practices. Um, and some of the faith community nurses have created whole ministries where most of them were Christian in background, and Muslim and Jewish populations have. So that's the term that I think
Okay.
encompasses faith community nursing. I think is probably the best nomenclature now. Yeah.
Thank you very much for that.
Anyone else? And as we're presenting and you're having different questions come up, is this a certificate program? David, what in particular do you mean about that with the certificate program for faith community nursing in particular?
Yeah, well, I was looking on your website. What is the name of the course that you offer?
Yeah, so here's a wonderful example that we had a program, a Faith Community Foundations program at Wesley. But one of the particular things is, as you all know, you can only do so much with your role. And so one of the things that I focused on was health ministry. And then I partnered with other hospitals or agencies. So in my area, I have Holy Cross Hospital, which is a Catholic health system, or the Adventist. Um, and then I mentioned some of these other programs that are online. We called it a certificate program because we worked with a local hospital, but in essence, it was the basic foundations program, and then we could give, CEUs or other things with the affiliation of the hospital, giving those professional nurse continuing education credits, but we had to work in tandem with that to happen. So yes, it's listed as a certificate program on our website, but we have to partner with a healthcare institution in order to have, because they have that American Nurses credentialing, um, training or body that gives those nurses CEUs and continuing education.
Okay, thank you.
Yeah, and we just decided to do that because the evolving part, even at our local hospital system, they went through a whole piece where they still work with faith community nurses, but they don't offer the education. And Adventist also doesn't, in my local area, offer a faith community training. So I try to the best way to put this is have organizations and partner with them or collaborate. They do the best things that they can well, and then I come in to partner with them so that I don't feel like I'm doing it all on my own. And this is a great ministry practice in today's context with ministry. Tim, yeah, you have your hand up?
I do.
Yeah.
Um, one of the things I wanted to kind of get your take on, or at least your experience on, is that um, it as part of this role as we're developing it and looking at what health ministry means for our church.
Yeah.
We would like a part of it, or at least we've spoken about this part that would have an outward community basis in which our
Yep.
community partners, a senior adult center, senior citizen center that we're
Yep.
partners with, actually serve on the board, and we have a table of plenty that serves an impoverished community. We would love to have opportunities in which this role can interact with their ministries. And what's your take on that? And have you been part of anything like that?
Yeah, Tim, I think the biggest part there with a faith community nurse or whoever it is the financing of trying to support someone. So what organization would be the one to support that? Is the faith community nurse someone who is doing this not dependent on the financial role? Are they at a state, to be able to do that? I think that the area, Tim, that you're talking about with those relationships and strengthening them, you can look at different things that in order in that partnership to see where the needs are. And so doing an asset map of those partnerships. I also have a tool called the collaborative opportunity assessment that I can share with
Okay.
Donna. And it's a wonderful thing as you're defining what a partnership might be with your partners that you talked about. And I think even being on the board is an important part because you can see what the needs are. And then, one of the particular things that I find is that sometimes when you're establishing things, they evolve organically. And so
Yep.
sometimes finances might not be there, but staffing, people can provide staffing or resources. This tool that I'll provide to Donna can help tease those things out
Right.
and look at that a little bit more. The other thing I want to say is pastor support for any of this is crucial. And the understanding of pastors, I
Yep.
can't emphasize that enough.
Yep.
Without that, this goes nowhere. And so, Tim, for you to be on and other clergy or pastors, that's extremely important to do that. And there's videos out there that I can send you from different organizations to give a little bit more background and such. But without that, this goes nowhere, too. So,
Mm.
yeah.
I was in a church. I was in church, kind of my home church before I was. I'm by vocation and second career pastor, and so the church that I was active in during the time I went to seminary, they had a parish nurse, and so that's how I was most familiar with the program and the work that they do. And so it is vital that they work hand in hand with the minister of the church, the pastor of the church. So I'm 100% agree.
Yeah, and it's a great support. I
Yeah.
think, I've seen a lot of pastors that talk from, give sermons and such and their own witness and how that connects and evolves, in my work. And I've seen that transform churches tremendously. Even how you do those assessments, and then if you don't communicate those results out, you lose people. There's different ways to do this and build up trust. There's a question here too about focusing on the individual and confusion around vaccines and families. And I had this, would this program be considered a family unit? I'm unclear what that means to considered a family unit,
Catherine, could you clarify, please?
because it's a very good question,
Mhm.
especially around vaccines and such. Yeah.
I don't know if she's able to unmute
Yeah,
or if
it's,
she's
I
available
think
to
I'll do my best.
elaborate.
I'll do my best. And then I know Donna, I'm over.
Hello, can
Yeah.
you hear me?
Yeah, go ahead.
Okay, I was thinking that it might be the one member of a family that would seek um, guidance. You're talking about education, and who do you listen to consider your options for a family? And so I know the physical individual needs, but is that ever an area for a parish nurse to just provide information on a more holistic, here are the things to consider about vaccines or who to look for. That's what I was wondering about.
Yeah, I think Pat talked about this a lot, was that counseling role is one of those things that connect to a variety of different resources. Um, that's one of the roles of a faith community nurse, is to help them kind of see those variety of different options or talk that out with them. And so having someone with that health background and experience is extremely important. The other thing I think, just in the normal, as a nurse myself, and the wide variety that you have, professional organizations, doctors and nurses and such, who are providing, um, back just around vaccines and such, which is obviously contradictory to some of the HHS, or Health and Human Services things. So they can help to navigate or talk those things out. And the reliance, the standards for practice and immunizations and all that, really haven't changed a whole lot, from those professional organizations, and they can help them navigate what those sources are, those trusted resources, and what is helpful for their family in terms of making decisions around those.
Okay, thank you.
You're welcome.
What I'd like to do for just a moment, I would just like to interject and make one additional comment or clarification. As I indicated earlier on, and some of you may not have been on the call at that particular point, I have established a Google Drive folder that will be shared with anyone who is interested in obtaining some resources that we have available. As Dr. Pruski has just indicated, he's going to share additional items with me. I will populate those into that Google Drive. So if you're interested in obtaining a link to that particular drive, would you please take a moment and put your email address in the chat? I will use that. You can either do that or you can email me directly. My email address is on the website, ncpresbytery.org, under leadership. You'll find me there. So if you prefer to do that, that is fine as well. Our intent is to begin this drive so that we can begin populating things. If you in your work in your individual churches find some resources that you believe may be beneficial across the board, I would love to put those up as well. The intent is to possibly start a grassroots endeavor that someone within the group may bubble up and decide they want to start leading some things that maybe in a collaborative way are churches that are in a given regional area that it's beneficial to work together, maybe for a blood drive, not for a blood drive, maybe for blood pressure checks or a flu clinic or something like that might be helpful. We're hoping that maybe something will bubble up from this conversation today. And what I'd like to do at this point is just to open it up for Q&A for additional questions, if any of you have any questions for either Pat or Dr. Proust. And I see a hand from Pastor Amy.
So this is a question. I got a call the other day. I'm a pastor in Somerset County, Maryland. I got a call the other day from our health department connection. And John Hopkins is doing a community nursing initiative program. I wasn't sure if you knew anything about that, or if I mean,
Yeah,
it's not a faith, but it's still community nursing.
yeah, Amy. What I know of that specifically to community nursing within probably the school itself, Bayview Hospital has a program which it's within Baltimore itself, with churches, faith communities, where they train people alongside medical students, which is slightly different. The program with Health Minister Certificate focuses more on holistic and not solely from, again, this is the idea with health and defining it not in a biomedical model, but in a whole person model. So yeah, Amy, it's something different in particular with Johns Hopkins itself. They might have clinical rotations where they work with different churches or community organizations too, but I'm not familiar with that.
Wonderful, thank you. Does anyone else have any questions or comments? We would love to hear from you.
And you know, the other part to this is that the health ministry certificate for those who aren't nurses or you're interested in that, maybe there's a possibility to get a broader understanding of this and go through our course for the spring semester is getting ready to start. I know it's kind of soon and you all have probably things you're already on your calendar, but it starts at the end of the month here and goes till May, and most of it's asynchronous. And so it fits into life and ministry. So if you're interested in that, maybe there's some opportunity where maybe we can do a couple scholarships or something for people who are interested to start this and get a little bit more understanding behind it if you're interested in that. I'm throwing that out there. So, Amy, I'm sorry, go ahead. You got your hand up.
I had another more, kind of logistic question. So if
Yeah.
hypothetically, if I was at a church who had no nurses,
Yeah.
but was like, oh, I like this idea. Oh, this sounds really something. We love the holistic approach. There's needs for health in our own people, but our neighbors.
Yep.
Is there like a database? Is there like is there a website to say, hey, we're looking for like is there a place to find parish or community nurses? Like, is there I mean, I don't think you'd do like a Yelp, but like,
Yeah, I think the Health Ministries Association is the
okay.
probably as the professional organization, Amy would be the one. But like I said, I think a lot of folks have retired. There was a lot of
Mhm.
older nurses just in general. I would
Yeah.
also say, Amy, the biggest part there is as I was contextualizing the ministry in general, is that if you had someone who is interested and passionate, the health minister certificate would be a great place to start so that you could become familiar with that and receive that training and really spark that interest. So you're also not just looking for the nurse, you're supporting people's growth in their faith and understanding and community and willingness. And so that's why this was created with a health minister certificate.
Okay.
And
Thank you.
Amy, in the Google Drive,
Mhm.
Pat very generously gave us some contacts for parish nursing and additional to organizational contacts. And that Health Ministries Association that Dr. Pruski just mentioned, the contact information is on that list. So you all will be able to see the link to this file tomorrow morning when I distribute it to you all.
Yeah, this does seem like one of the programs that our denomination has decided to be out of fad. Because I definitely, my previous church had a parish nursing program and it had a good ministry, but it was a retired nurse, and now she retired 40 years ago. So so it just didn't stay. But this is exciting to have the new iteration of this coming back up and being in front of us again. So thank you.
Yeah, I'm very thankful for all of you just to come to this because ministries changed and evolved, and I think the latest pieces of the evolution of this, and there's different roles that people can take on, and to reinvigorate or take on, like I said, to actualize their faith. And so we've had pastors take the health minister certificate to learn more about health and wellness. It was wonderful to see a pastor or Tim or whoever it was on the treadmill. That's awesome. Like that is actually a wonderful part to see embodiment of that. And so the training also helps to contextualize this or prepare people for this ministry itself. We talk about what hospitals have to do, for example, in their to maintain their nonprofit status, um, so that you can hold them accountable with their resources or engage with them with their community health needs assessment. It's done every 3 years. And if they don't do that or engage, then there's a $50,000 fine that they have to pay if they don't have a specific plan. So we go over all this in the training. We talk about active listening. I mentioned a lot of those different things, different models. Um, and then the other part is the support afterwards, is with this network that I've continued to support. We were going to end that support, but all of the health ministers, including faith community nurses who are part of this network, said, no, you can't stop this because we need this trusted. And I have folks from communities, all different backgrounds, cultures, underserved communities who are part of this. So.
Well, I want to take this moment to say thank you, Pat. Thank you, Dr. Pruski, and participants today for being involved in our training this evening. We have felt that this is timely. There are a number of things happening in our challenging world today that we believe that churches are once again going to be at the forefront of being able to reach out to our community, lend our spirited hearts and hands to guide them as they come across some challenges that I think for all of us are going to be very, very hard. So thank you again. It was wonderful to see you all this evening. May you go with grace. And I look forward to communicating with all of you via email tomorrow morning. Have a great evening. Thank you.